Hi, Mark Salzer. Thanks for being here today to talk about the visual activity sort. Can you briefly introduce yourself and tell me more about your area of expertise?
Sure. I'm Mark Salzer. I'm a clinical psychologist and professor of social and behavioral sciences in the College of Public Health at Temple University. I also direct a federally funded center on community inclusion of adults with serious mental illnesses.
How has the visual activity sort been useful with the individuals that you work with?
So my work around community inclusion is attempting to understand any issues related to the inclusion and participation of adults with serious mental illnesses. So people diagnosed with schizophrenia, bipolar disorder, major depression, and really what they do in the world. Work, going to school, leisure, recreation, engagement in faith communities, voting and volunteering, really anything like anybody else, social relationships. And we're very interested in talking to people about what their interests are in the community. What do they like to do? What's important to them? Do they do things enough, not enough, or too much? And we have developed a self-report measure that we've used in the past, but we're really interested in understanding the different ways to have conversations with people with serious mental illnesses about what they like to do, what their interests are, what they are doing. And when I came across the visual activity sort, I loved it. Most of our work has been written. It's been on paper, so it requires some verbal abilities as people read. We do have interviewers or clinicians who might go through the form with people, but obviously the visual activity sort also is nonverbal, so people can see it while they see the words and think about that activity. And I think it's terrific. People seem to be responding to it pretty well.
Awesome. I appreciate that feedback about how the visual component helps with the different levels of literacy. What do you like most about the visual activity sort?
I think that it really is the pictures. I think the visuals along with the activity really helps people be even more reflective about that activity. We do hear from, one of the reasons I work in this area actually is that people with serious mental illnesses say that people don't often ask them these types of questions. They don't ask about their interests. They don't ask about what they're doing in the community too much. And I think that the visual aspect of the cards really helps connect to people and helps them be more thoughtful in their responses. So that's what I really like about it. Actually, a second thing is it's pretty comprehensive. It addresses a lot of different occupational areas as OTs might talk about it. I talk about it in terms of participation domains and really specific areas within those domains. So that's the second thing I like about it.
Thank you. I really appreciate your feedback. In addition to the population you work with, what other client bases and health professionals do you think would benefit from the visual activity sort?
I think it could be used by individuals in many, again, I work in mental health. So I think it could be used by anybody, any mental health professional, a psychiatrist, a nurse, a psychologist, social workers, OTs, recreational therapists. Anybody could really use this. Peer specialists, we do have a number of peer specialists in our field, and I think it can be really useful for having a conversation with people about what they want to do in their lives. I also think it could be used in a lot of different programs. I mentioned to you before, we're starting to pilot it in an inpatient unit where we're talking to people who have been in a psychiatric hospital for a long time, and just to start exploring what their interests are, to see if we can help connect them to some of those activities now, even while they're inpatient. but this could be used in case management programs, outpatient, day programs. It could really be used in any type of mental health program that's out there. But I do think it can be valuable as a research tool as well as a clinical tool or an assessment tool. We've been using very similar types of tools. Again, this written measure that our center has created as a clinical assessment tool to develop some supports planning. But the visual activity sort really can be used clinically as an assessment tool, as an evaluation tool with individuals, but it can also be used as a research tool, I think. And I really look forward to doing more work with it in the future to test, how useful it is in assessing people, looking at change over time in terms of interests. Another thing is you've done a great job with your colleagues to develop some ideas for how it can be utilized, but I also think it's a really flexible tool as well. So we can follow the process that you outline, or that are outlined with the visual activity sort, with the actual cards and some of the other materials. But it's really a flexible tool, so it can be used in a lot of different ways. Yeah, I think people should take a look at it. People should have conversations with folks they're working with to see what they're doing and really support them in being more active in the community.